Respected principal, teacher and all my dear friends, my name is Shyam Sharma. Here I am in front of you to present a presentation video on coronavirus, that is COVID-19. I will discuss some points which are when a disease take the form of an epidemic, how did corona spread, importance of lockdown and why there is a need for lockdown, and last we will talk about vaccine. How will corona died? So let's start. So let's talk about when a disease take form of epidemic. We all know that coronavirus become an epidemic in the world. So an epidemic becomes a pandemic when it spreads over significant geographical area and affects a large percentage of the population, like COVID-19. So let's talk about how pandemic is different. It affects a wider geographical area, infects a large number of people, often caused by a new virus like COVID-19. Humans have little no immunity against the virus and it spreads quickly, cause more deaths, create social disruption and economic loss. So next point is, how did corona spread? People can catch COVID-19 from others who have the virus. It spread person to person through small droplets from nose and mouth, which are spread when a person with COVID-19 cough or exhales. These droplets lands on objects and surfaces around the person. Other people can catch COVID by touching these objects surfaces, then touching their nose and mouth, and also catch the virus by breathing around the infected person. So let's talk about COVID-19 symptoms. The symptoms are fever, tiredness, dry cough. Some patients may have aches and pains, nasal congestion, runny nose, sore throat or dihydria. So let's talk about COVID-19 precaution we should take. Always wear mask at public place by washing our hand. Use sanitizer in case water is not available. Maintain social distancing. 3 feet distance is mandatory. Don't touch unnecessary surfaces by boosting our immunity. So let's talk about next point, which is importance of lockdown during COVID. According to government, lockdown is defined as emergency protocol that is implemented by government authorities to prevent people from leaving their home. People are not allowed to travel or go outside. Under lockdown circumstances, one can't go out to work, mall, cinema, etc. Essential services are allowed like medications, bank in that crucial time. Not allowed. All transport, flights, trains, roadways, all government offices, commercial and private establishment, industrial establishment, hospitality establishment, education institutions, all social, political, sports, entertainment, accommodation, cultural religion function, etc. were not allowed in lockdown. In this time, we know that lockdown is unlocking. But in lockdown, we use technology in a proper way. Some people do work from home. Some students learn from home. Some pupils do online shopping, etc. But negative effect of lockdown is unemployment. We know that some labor migrate to their villages. GDP growth down. Its negative effect on economic growth on country. So let's talk about last point, which is how corona can be dead. And we will discuss about COVID-19 vaccine. We all know that serious patients need hospitals. But how they can recover? There are two options. One is vaccine, which is on working stage and scientists are making the vaccines. COVID infected people can be recovered by plasma therapy, in which COVID recovered patients donate the plasma, which has immunity to fight against the virus. The donated plasma is injected to other patients and develop the immunity and they can recover. So let's talk about COVID-19 vaccine. We are waiting when vaccine will be ready. But what is vaccine? A vaccine is a substance that helps to protect against certain disease like COVID-19. Vaccine contains a dead or weakened version of a microbe or virus. It helps to our immune system to recognize and identify the virus and after that destroy the living microbe during a future infection. It has its advantages and disadvantages. But our scientists are working across the world. Hope you like my presentation video. Thank you very much.